Hello and welcome. In this video, we'll talk about how to treat constipation at home. Constipation is one of the most common digestive problems in the world. Around 16 out of 100 US adults have constipation, and the number doubles for adults over age 60. Women suffer more from constipation than men, which can be due to effects of female hormones on the GI tract and slower movement of food through the women's intestine. What are the symptoms of constipation? Each person's bowel habits are different. Some people go 3 times a day while others go 3 times a week. However, you may be constipated if you experience the following symptoms: fewer than 3 bowel movements in a week, passing lumpy, hard, or dry stools that look like rocks and pebbles, straining or pain during bowel movement, a feeling of fullness even after having a bowel movement. Constipation can happen for many reasons, such as stool staying in the colon for too long. The colon's main job is to absorb water from food as it passes through the digestive system, then it creates stool. If the stool remains in the colon too long, it can become hard and difficult to pass. Low fiber diet, especially diets high in meat, milk, or cheese. Dehydration. If you do not have enough fluid in your body, large intestine soaks up water from food waste and makes your stool hard and difficult to pass. Lack of exercise, severe stress, lack of sleep, pregnancy, certain medications such as aluminum and calcium containing antacids, calcium channel blockers, seizure medications, narcotic pain medication, diuretics, iron supplements, and medication used to treat Parkinson's. Lastly, we have underlying health issues such as stroke, diabetes, Parkinson's disease, hormonal problems such as hypothyroidism, problem with the colon such as bowel obstruction, irritable bowel syndrome, diverticulosis, and overuse of laxatives. How can we prevent and treat constipation at home? Dietary changes is the most important step to treat constipation. In most cases, constipation is caused by poor dietary choices such as low fiber intake, foods high in fats and sugar, and eating too much junk food. Therefore, adding fiber to your diet can help with constipation. Fiber promotes regular bowel movement, especially when combined with proper fluid intake. Add high fiber foods to your diet such as fruits, vegetables, whole grains, nuts, chickpeas, beans, prunes, or brown cereal. You should aim to consume 20 to 35 grams of fiber every day. You should also cut down on low fiber foods such as meat, cheese, milk, and processed foods. Staying hydrated is another way of preventing and treating constipation. Drink 6 to 8 cups of fluids every day, such as water, vegetable juices, clear soups, and natural fruit juice. Try to limit consumption of alcohol and caffeinated drinks, which can cause dehydration. In some people, caffeinated coffee can cause muscle in the intestines to contract and stimulate a bowel movement. Therefore, drinking a cup of caffeinated coffee might be helpful to some people. Number 3 is probiotics and prebiotics. Consider adding probiotics to your diet. This can be found in foods such as yogurt and kimchi. Some studies have shown that adding probiotics can be helpful for people with chronic constipation by restoring healthy bacteria in the digestive system. Prebiotic foods such as apples, bananas, oats, asparagus, garlic, and onions provide nutrients to the good bacteria. Another way to prevent and treat constipation is lifestyle modification. This can be achieved by getting regular exercise. Aim for about 150 minutes of moderate exercise every week with a goal of 30 minutes per day at least 5 times per week. Try walking, swimming, or biking. Also, stretching and yoga can ease constipation. The other lifestyle modification is stress management. Stress can cause changes in the release and action of the neurotransmitter in the bowel. These stress-related changes can directly affect your bowel function and result in constipation or loose stools. Number 3 is bowel retraining. Train your muscles to have a bowel movement at the same time each day. The best time is about 20 to 40 minutes after eating. Plan to spend about 10 to 15 minutes on the toilet to see if you will have a bowel movement. Make sure not to strain as you try to go. Also, you can raise your knees by putting your feet on a stool when having a bowel movement. This will place your hips at an angle that will not constrict your rectum. And remember, bowel retraining can take time. Number 4 is not to delay the urge to have a bowel movement. The longer you wait, the harder your stool can become. If home remedies do not not work, a healthcare professional may recommend an over-the-counter laxative. Laxatives are a type of medications that help in emptying bowels. They can be taken by mouth as a capsule, tablet, or liquid, and they can also be taken through the rectum, such as suppository or enema. There are different types of laxative, which depends on how they work. Number one is fiber supplements or bulk forming laxatives, such as metamucil. They work the same way as dietary fiber, which increases the water content and the bulk of the stool. If you add fiber supplement, remember to drink plenty of fluid. Fluid helps fiber work more efficiently. And remember, this may take 2 to 3 days to work. Number two is osmotic laxative, such as milk of magnesium, Miralax, or lactulose. They promote movement of water into the center of the colon through the process of osmosis. This makes the stool softer and easy to pass. They may take 12 to 48 hours to work. Number three is stimulant laxatives such as Basacoto and Senna. They make the intestine contract and push the stool out. Since they cause the intestine to contract, they can cause abdominal cramping. And remember, they can take up to 12 hours to work. Number four is stool softeners or emollients such as Docused and Glycerol. Although Docused is widely used, it has very limited clinical efficacy. Be aware that if you use Glycerol suppository, it might take 10 to 15 minutes to work, so be sure that you're close to a bathroom. Like any other medication, laxative can have side effects, and never use laxative for more than 2 weeks without talking to your healthcare professional, because your body may get used to it. If home remedies and over-the-counter medication do not relieve constipation, your doctor may prescribe medications such as lubiprostone, Linzess, prucalopride, and methotrexate. Constipation is most often acute, meaning that it appears suddenly, for instance, when you're traveling, and lasts for only a short time. But when it becomes chronic, pay attention and see your doctor, because chronic constipation can cause complications such as hemorrhoids, anal fistula, inability to push stool, and rectal prolapse, which is a condition where part of the rectum sticks out of the anus. Thank you for watching. Please like and share the video. And until next time, stay healthy, and remember, health is the greatest wealth.